Hi friends, good evening. I'm Dr. Ashutosh Gupta. Or in today's scenario, whenever we are doing the IVF, earlier we used to have three embryos or multiple embryo transfers. But now what we've identified over the period of time is this that there are a lot of complications with multiple pregnancies, right? So now what the IVF people are practicing is only one embryo or two embryo transfers, right? So, but the thing is this, those embryos might get divided into two, right? Okay. And therefore, what we can have is a monoclonic set. So, meaning thereby that even if you do have one embryo transfer, that embryo might get divided into two, or it is a two embryo transfer. So, one embryo gets divided into two, and therefore, you can have a sort of an DAMC, diamniotic monoclonic twins, or you can have it TADC, or meaning thereby dichorionic triamniotic triplets. So meaning thereby that there are two sacs, there are two placentas which are different, and so one of the sac is having a one baby, but one of the sacs is having two fetuses, right? So this becomes a TADC, triamniotic dichorionic triplets, right? So as we know that getting a triplet pregnancy is not medically justifiable, because then there are a lot of complications with triplets, right? And there could be some specific complications that happens with the subset of those monoclonic pregnancies, like TTTS can happen, twin to twin transfusion syndrome can happen. We can have a TAPS, which is called as a twin anemia polycythemia sequence. So that happens in 5 to 7% of the cases. Even though with the triplet pregnancies, carrying them to term becomes very challenging and all those stuff. So meaning thereby that we have to reduce one of the babies, and therefore carrying a twin pregnancies at something like 35 weeks, or probably we can have a take home baby, right? So what we're having is a triamniotic dichorionic triplets, in which one of the fetus is having hydrops, right? Okay, so we are dealing this situation at something around 12 weeks. So this is in very early gestational age, in which what we can believe is this that TAPS or TTTS, they cannot be the reason for this sort of a very severe hydrops fetalis in one of the monoclonic set fetuses, right? So the ultimately, so genetically they should be the same, meaning thereby that probably we cannot assume that the one of the set, that one of the fetuses out of that set can have Down syndrome or the Turner syndrome, and the other one would be normal. So the possibility could be theoretical, but practically should be very bleak, right? And the third thing that can lead to this hydrops could be infective, right? So infection could be parvo or a CMV leading to hydrops in one of the fetuses and not leading to another one. The possibility is also because in the placenta and then the blood supply to that set of the monoclonic set twins is almost the same. So that is what it is. So this is a very intriguing and an interesting case. So that we'll discuss today. तो इसको ध्यान से देखिए. So we can identify the thick membrane and the thin membrane. So this becomes a TADC triplets. So this is one of the fetuses of the monoclonic set. So this is hydrops. So generalized anasarca. This is the second baby of the same set. So we can identify that there is no fluid collection. So look around in the baby once again. So it is a generalized anasarca, and then we are having this ascites and pleural effusion. So this is a complete hydros fetalis, and then we are seeing at 12 weeks. So this is what we are trying to put the needle, and then we are trying to reduce this baby, right? So the needle is there in the heart, and then we are putting a minimal amount of KCl. So this is a case of a TADC triplets, in which one of the fetus is having hydrops. So how do you explain the hydrops in one of the set of the monoclonic fetuses? So if you talk about that, this could be genetic. So this could be Turner's or this could be Down syndrome. Why not the other one is being affected? And if we talk about that, this could be a some sort of a atriovenous sort of a connection or an imbalance between these monoclonic sets. So could be a TTTS or could be a TAPS. But then it is very early, meaning thereby that we are talking about a 12 weeks and having that florid hydrops happening at such a early gestational age of 12 weeks. The possibility is very bleak and very remote. Now the third thing which remains is could be an infection, right? So any viral infection leading to this thing, so parvo could be the one, parvo B19, or could be a CMV infection, and then, but then, since we identify that the placenta is the same, and therefore the blood connection should be the same, and therefore why one baby is being affected and the other one is normal, so that is what it is. So meaning thereby that many a times we identify that this sort of when the whole clinical situation becomes very, very perplexing and very difficult to sort of explain, right? But eventually the triplets were there, and therefore it was a TADC. So meaning thereby that we have taken the due consent that probably we are reducing one of the monoclonic set, which is an hydropic baby. So there could be some finite possibility of something around 5% that the surviving co-twin of that monoclonic set might even also go away, either because of that thromboplastin being released from that demised fetus, and that therefore leading to the demise of the second co-twin. And therefore we were attempting to do the reduction, and then we were lucky enough that probably we went to the heart. Now, in such an hydropic baby, what happens is this, that the blood is very minuscule and it is everywhere. There is a fluid. So, but then we were lucky enough to get to the heart, and then the baby responded very well to our treatment. And ultimately, both the babies they survived, meaning thereby that that hydropic fetus of the monoclonic set went into a cardiac asystole, and therefore we achieved whatever we had aspired for. And by the end result remained is this, that a TADC triplets was being reduced to DADC twins. So meaning thereby that a lot of complications out of this monoclonic sets is also out of the window, and therefore we have taken this uh, hydropic baby out of this situation at a very happy gestational age of 12 weeks, right? But the etiology leading to all these things is very perplexing, right? Thank you very much for your patience.